Okay, it's time to talk about ACE inhibitors, angiotensin-converting enzyme inhibitors. We're talking about the conversion from angiotensin 1 to angiotensin 2. So let's talk about a clinical case. A 53-year-old female with a history of hypertension and diabetes presents to your office complaining of a chronic cough of 2.5 months duration. Upon further questioning, she denies any fevers, chills, sweats, or recent respiratory illnesses. She denies cigarette use. Her medications include an oral hypoglycemic agent and a hypertensive agent that she began 3 months ago. Physical examination reveals a blood pressure of 126/82, and her lung examination is not significant. You begin to suspect that this patient's cough may be related to her new antihypertensive medication, and you suggest switching medications. So let's talk about this ACE inhibitor. So the ACE inhibitors are the prils, so representative one would be captopril, many others. So the mechanism of action: the ACE inhibitors act by inhibiting the angiotensin-converting enzyme, peptidyl dipeptidase, which is responsible for hydrolyzing angiotensin 1 to angiotensin 2 and for decreasing the inactivation of bradykinin. When you hear bradykinin, you may think about cough. A vasodilator, bradykinin is a vasodilator. Angiotensin 2 has the following actions. First, it is a vasoconstrictor. It increases perfusion pressure in the glomeruli through vasoconstriction of the efferent arterioles of the kidney. It stimulates aldosterone production, which leads to the increased salt and water retention by the kidney. By decreasing levels of angiotensin 2 and increasing the levels of activated bradykinin, the ACE inhibitor act to decrease peripheral vascular resistance and to decrease the effective circulating volume of fluid in the body. Clinical uses in the treatment of hypertension and congestive heart failure, also used to treat and prevent diabetic neuropathy. ACE inhibitors have also been shown to decrease mortality in post-myocardial infarction patients. Cough, hyperkalemia, and renal failure in renally insufficient patients. Hypertension, teratogen, may cause fetal renal damage if used during pregnancy. Angioedema. So you might relate the cough with the bradykinin, so we need to understand that relationship. So that is ACE inhibitors. Thank you very much.